Welcome to the course on control of diabetic retinopathy. In this third module, we will focus on understanding the healthcare provider. We will examine the interaction between the provider and the patient, and also refer to the barriers to uptake of diabetes eye care services such as screening for diabetic retinopathy. We will examine possible strategies to address these barriers, such as giving health talks. Let us start by considering a case scenario. 4 months ago, when you gave the first laser treatment to your patient, you explained the side effects. Today, the patient asks you, does the laser have side effects? What would be your reaction? Take a moment to consider the possible responses and write down your preferred answers. A. The side effects are eye pain, blurred vision, and difficulty driving at night. B. I will have the nurse explain this to you. C. Why do you ask? D. Would you like me to check for possible side effects? E. The side effects are minor. Do not worry. We will come back to this case scenario in a short while. The interaction between the provider and the patient is the interaction between the professional role and the patient role. Both of these roles are distinct, and both of these individuals have particular values and preferences. Patient-related factors may affect this interaction. Some of the factors might be demographic characteristics such as age and sex, disease severity, comorbidities, disability, embarrassment about body weight and poor control of blood sugar, pressure, social circumstances such as ethnicity and education, language barriers. Can you think of the ways in which these factors might affect the interaction? Can you give examples from your own setting? In a similar way, provider-related factors may affect the provider-patient interaction. This might include the interpersonal and clinical skills of the provider, the workload, the resources available, the communication modalities, the need for confidentiality, the use of clinical guidelines, the provider's own values such as paternalism and mutual partnership, the provider's adherence to lifestyle changes that are relevant to diabetes and diabetic retinopathy. What factors do you think might apply in your own case? Which of these factors might you have experienced in the past? We come back to the case scenario where you had explained the side effects of laser to your patient a few months ago, and the same patient asks you about the side effects again. In which instances would you list the side effects the patient again? In which instances would you send the patient to somebody else to make this explanation? When is it appropriate to find out why the patient is asking this question? When might it be appropriate to take this as a cue to check for possible side effects? Would it be appropriate to dismiss this concern as minor? Reflect on this based on your setting. In Module 2, we looked at the determinants for DR screening that are related to the patient. We now want to consider the provider-related determinants for DR screening. The practice of DR screening may depend on the health provider's knowledge. This might be, for example, knowledge about diabetes, knowledge about diabetic retinopathy, knowledge about screening, knowledge about where these services can be provided. It may rate the attitude of the health provider regarding the need for DR screening. It might be the practices of the health provider, such as referral practices, patient education, using guidelines, or documenting and using the records. How would each of these factors affect the practice of DR care services? We will explore this in more detail in this module. The healthcare provider can also be instrumental in reducing non-attendance to screening. This might be done through educating the patient, such as through individualized education or health talks to groups of patients. It might be through sending reminders such as postal reminders or telephone reminders or email reminders to patients on your database. It might be through placing the screening tools in the diabetes clinic. It may be through monitoring patient satisfaction with diabetes eye care services. It might be through implementing clinical guidelines. What other strategies can you use to reduce non-attendance? A healthcare provider can also influence the behavior of the patient. Which behaviors are most important? This might be stopping to smoke, having a retinal examination at least annually, maintaining a healthy weight, regular exercise, taking medication, eating a healthy diet, and checking blood sugar and blood pressure regularly. When we give health talks on diabetic retinopathy, we may want to talk about those healthy behaviors. As we do that, we need to understand adult learning. There are 4 main principles about adult learning that are outlined in the adult learning theory. One is that adults need to know why they need to learn something. 2. Adults need to learn experientially. That means the learning should be linked to the tasks that they need to do. Thirdly, adults approach learning as problem solving. And fourthly, adults learn best when the topic is of immediate value. How can we apply these 4 principles to health talks on the health behaviors we have just mentioned? An example is a health talk on a dilated eye exam. The first principle is that adults need to know why they need to learn. So the reason for this talk is that all people with diabetes are at risk of diabetic retinopathy. How does this talk link the task the patient needs to do? The patient should not wait for some symptoms to occur, but should have a retinal examination at least once a year. How is this talk linked to problem solving? Explain that a retinal examination helps to detect the disease early. And what is the immediate value? Explain that the examination is available at the nearest eye clinic, and if that one is found to have diabetic retinopathy, timely treatment can help prevent visual impairment. By the end of this module, you should be able to explain the importance of multidisciplinary care for patients with diabetes. You should also be able to demonstrate effective communication with patients, conduct a comprehensive patient evaluation, and also give a health talk on DR. All the materials on this course are licensed under the Creative Commons license, and they are free to use, reuse, and share so long as you attribute, use them non-commercially, and share alike using the same license. We hope that you find the course useful.